In this section, we'll be talking about arterial lines. Now remember, arterial lines are catheters that go into an artery. There are different locations that may be chosen by the physician for an arterial line, like for example, the radial artery, like in this case, a brachial artery or a femoral artery. Now, you see that this catheter is actually an IV catheter, but generally a catheter that is used for an arterial line is slightly different. It is a 20 gauge thick catheter with a flexible tip, and it's slightly longer than a regular IV. So it does look like an IV, but it is the material that it's made from is also different because we need to be able to sense pressures through this catheter. So for the purposes of this video, we'll assume that I'm wearing gloves and I will preserve sterile technique throughout. What we will talk about is first how the arterial line is set up. You will see that I have the syringe attached here, and how the arterial line connects to your transducer. As you recall, we use special pressure tubing to attach our arterial line to the transducer in order to be able to sense differences in pressures. Another thing you will notice, there is a number of stopcocks on this line, and you will see why in a second. Bear in mind that there are two different types of a stopcock that may be used. There is the two-way stopcock, like so. So it only has an open and closed configuration. And there's a three-way stopcock that allows you to open and close the line in different directions. The only off position is where the little tail is. So right now my line is open for the blood to flow, for the blood or fluid to flow this way. The other thing you will notice, as I was mentioning, is this syringe. This syringe is called a safe set, and this is something that is used in critical care setting in order to sample blood from a patient without losing the blood sample that you would normally throw out when you take a blood sample from a catheter. Okay, so we do not need to waste blood with this syringe. Also, it preserves sterility. So, how do we take blood out of an arterial line? Because this is one of the very useful things that we can do with it, other than measuring arterial pressures. We will use the safe set syringe, and you will see the port from which we can withdraw the blood. The port can be accessed via a special luer lock, which is already attached here. It is a separate attachment for our syringe. So when you are putting together your set, you will need to go get the special piece to be able to access the safe set. Another thing that you will need is obviously your tubes. If you're sampling blood for CBC, CAM7, or any other blood test, you will use the corresponding colors. If you're sampling arterial blood, you may have to use different syringes. You may see a syringe like this or a syringe like this. Okay, if it's open, a syringe like this will actually look like this, and it has a little green cap. Depending on the setting that you go into, you might see different syringes. Another thing that I want to mention about this syringe is that it actually comes with a needle that can be attached to it for a direct arterial puncture. So if somebody just needed an arterial blood test without an arterial line, a physician or respiratory therapist could go and do an arterial puncture with this syringe.